Good morning. Today we will be discussing about space maintenance in pediatric dentistry. Contents includes introduction, factors to be considered in assessment of space loss, the treatment planning in space management, definition, objectives of space maintenance, indications and contraindications of space maintenance, the requirements of space maintenance, classification, various types of space maintenance, and finally conclusion. Coming to the introduction. The primary tooth plays an integral role in growth and development of child. It helps in mastication, speech, aesthetics, and also it helps in guidance and eruption of permanent teeth. Any factor that can be dental caries or trauma that result in premature loss of primary tooth can result not only in alternation in the permanent dentition, but also it affects the stability and eruption guidance of permanent dentition. So let's see what are the consequences of premature loss of primary teeth. When the primary teeth is lost, the adjacent teeth drift into its position, causing loss of space. When this primary teeth is lost bilaterally, it can result in decrease in arch width. It can result in drifting of the permanent teeth, impeding the eruption of succedaneous teeth, resulting in its delayed eruption. And when the permanent teeth erupt buccally, it can result in crowding in permanent dentition. It can also result in unopposed movement of opposing teeth, resulting in its supra-eruption. When multiple primary anterior teeth is lost, it will be having an aesthetic and emotional problem. When the permanent teeth erupt, it can result in midline shift. So, when a primary teeth is lost, various factors has to be considered in assessing the space loss. We have to evaluate the incidence of space loss, what is the time elapsed since the loss of primary teeth, the stage of development, and dental age of the patient should be evaluated. The amount of space closure should be measured. Direction of closure should be evaluated, whether it is from anterior segment or posterior segment. Eruption timing of the permanent successors, amount of bone covering the non-erupted tooth should be assessed, and congenital presence or absence of permanent teeth should be evaluated. Coming to the treatment planning in space management, a proper clinical and radiographic examination is initially needed. After that, we should collect all these diagnostic data, including radiograph, dental study models, and then we have to analyze the various stages of tooth development. Then analyzing of the tooth size and space available is done on the dental cast. After that, we should predict the growth and future occlusal relationship. From these diagnostic data, we have to plan whether we have to go for a space maintainer or a space regainer. When the space analysis shows there is a positive arch, then there is deficiency is less than 1 to 2 millimeter per quadrant, you can go for a space maintainer. When the space deficiency is 2 to 3 millimeter or greater, we should go for a space regainer, or we should also consider serial extraction and a comprehensive orthodontic treatment. So let us define various terms. First one is space maintenance. It was described by J.C. Brewer in the year 1941. It is defined as the process of maintaining a space in a given arch that is previously occupied by a tooth or a group of teeth. Space maintainer, as by Boucher, it is a fixed or removable appliance designed to preserve the space that is created by premature loss of primary tooth or a group of teeth. Space regainer, these are used to regain the space that is lost by the drifting of permanent teeth. It is a fixed or removable appliance capable of moving the displaced permanent tooth into its proper position in dental arch. Coming to the various objectives of space maintenance. First one, preserving the space. Then we have to preserve the integrity of the dental arch. We should preserve the normal occlusal plane. In case of anterior space maintainer, it should aid in normal aesthetics and it also aid in phonetics. Indications, the premature loss of deciduous teeth that shows the sign of closure. When the space for a permanent teeth should be maintained for 2 years or longer. To avoid supra-eruption of tooth from opposing teeth, it aids in or make future orthodontic treatment less complicated. And it is also indicated to improve the physiology of the child's masticatory system and restore dental health optimally. It is contraindicated when IOPA shows succedaneous tooth will erupt soon, when there is a space excess for permanent tooth, if the space shows no sign of closure, and it is also contraindicated when succedaneous teeth is absent. A requirement of space maintainer, it should maintain the entire space that is created by the tooth loss. It must restore its function. It should prevent the supereruption of one of opposing tooth. It should be simple in construction, and it should be strong enough to withstand the occlusal forces, and it also permit maintenance of oral hygiene, and it should not restrict the growth of the jaws, and it should not exert any undue force on its own. Coming to the classification of space maintainers, various authors has classified the space maintainer. First one, according to Hitchcock, it can be either removable, fixed or semi-fixed. Other one is with band, without band. Whether it replaces any function, can be functional or non-functional. Whether any forces is applied by the appliance, it can be active or passive, or it can be a combination of the above. According to Raymond C. Thoreau, it can be removable or complete arch. That includes lingual arch and extraoral anchorage and individual tooth. The common space maintainers used in pediatric dentistry, that is, fixed one includes band and loop space maintainer, lingual arch holding device, transpalatal holding device, transpalatal arch space maintainer, distal shoe, and other category is removable space maintainer. First, we will discuss about the fixed space maintainers. As the name suggests, the fixed space maintainers are fixed into the oral cavity, so the patient cannot easily remove and insert into the by its own. So advantages include it can be used in uncooperative patients. It is used when subcutaneous teeth is free to erupt, and it will not interfere with the eruption of abutment teeth, and thus the jaw growth is not hampered. The disadvantage include it requires more armamentarium as banding procedure is needed, and when the band is placed, it can result in decalcification of the tooth under band. It can also cause supereruption of opposing teeth, and it also can be harmful to the abutment teeth when torquing forces are activated by the appliance. First, we will discuss about the band and loop space maintainer. As the name suggests, it consisting of a band that is attached to the molar teeth and a loop that extends anteriorly to engage into the contact area of the anterior tooth. So, it is a unilateral, non-functional, passive, fixed space maintainer, and it is commonly used when there is a unilateral loss of primary first molar. It can be also used when there is a bilateral loss of primary molar in situation where the eruption of permanent incisors has not occurred. That is, before the eruption of permanent first incisors. Contraindication. High dental caries. In case of replacement of primary anterior teeth, in replacement of primary second molar, in primary dentition without partial clinical eruption of permanent first molar, and in cases that need guidance of eruption. Coming to the various modification, when a band and loop is adapted to the crown, it is known as crown and loop. When multiple tooth is lost, a long band and loop is needed. Such is known as long band and loop space maintainer. When it is used in reverse direction, it is known as reverse band and loop space maintainer. Instead of a loop and a bar is used, it is known as band and bar space maintainer. Next appliance is lingual arch space maintainer. The lingual arch space maintainer consisting of banding on molars and a wire loop that extend anteriorly to engage in the cingulum region of permanent incisors, central and lateral incisors that stabilize the lingual arch. It is bilateral, non-functional, passive or active appliance most commonly used in. It is used in mandibular arch, that is when there is multiple loss of primary molar in mandibular arch. Coming to the various modification, when a U-loop is incorporated, it is known as Holt's lingual arch. By activation of this appliance can be done by opening up of the U-loop. To prevent the distal movement of the canine, a spur can be attached. Such modification is known as the lingual arch with canine spurs. The lingual arch, that is a fixed appliance, can be made removable by incorporating a sheath on the lingual surface of the band, and such appliance is known as removable lingual arch. Next fixed appliances is Nance palatal arch. Nance palatal arch is commonly used when there is a bilateral or unilateral multiple tooth loss in maxillary arch. So it is bilateral, non-functional, passive, maxillary fixed space maintainer. Indication include when there is bilateral premature loss of primary molar, it can be also used when there's a combined with habits, that is tongue thrusting is present. We can incorporate spur in the acrylic button to correct the habit also. Contraindication. It is contraindicated when there is presence of any palatal lesion. It is also contraindicated when either of the first molar have not erupted into the oral cavity. Next appliance is transpalatal arch. This appliance was introduced by Robert A. Goshgarian in 1972. So it is also known as a Goshgarian appliance. These are unilateral, non-functional, passive, maxillary fixed appliances that is used in when uh, one side of the arch is intact and several primary teeth is missing on the other side of the arch. It consisting of banding on the permanent molar and a wire loop that extend from palatally, transpalatally. Indication, as we had discussed, it is best indicated when one side of the arch is intact and several primary teeth is missing on the other side. Disadvantage include when a loop is activated, it can result in rotation of molars. Next appliance is distal shoe space maintainer. Distal shoe space maintainer consisting of a loop that extends distally from the banded tooth and from the distal surface and intraalveolar extension, that is vertical arm extend. That depth of the vertical arm is usually 1 to 1.5 millimeter beyond the mesial marginal ridge of permanent first molar. This type of appliance is usually indicated when there is loss of permanent primary second molar, when there is loss of primary second molar before the eruption of permanent first molar. So this appliance is a fixed, unilateral, non-functional, cantilever type of space maintainer. As the vertical arm extend intra-alveolar, it is also known as intra-alveolar eruption guidance appliance. There are two types of space maintainer. Earlier type of space maintainer, it is made up of cast gold and it is also known as willer type. In this vertical arm consisting of bar type extension, as it is made up of cast gold, it is very costly and the design fabrication is very complicated process. The newer type, that is Roches type, in this vertical arm is made up of a V type of extension. The broader surface of this V prevent the rotation of permanent first molar. So indication when the primary second primary molar is extracted or lost before the eruption of first permanent molar. Contraindication, inadequate abutment due to the multiple loss of the teeth in medically compromised patient is also contraindicated in congenitally missing first permanent molar. Next group of appliances are bonded space maintainer. As the name suggests, they are bonded to the tooth surface. They can be either a fiber reinforced composite material that is directly bonded to the tooth surface, or it can be a it is available as a E-set space maintainer that can be bonded with the help of composite resin, or simply a wire can be adapted with the help of composite material and can be bonded to the tooth surface. Next type of space maintainer we will include is fixed anterior space maintainer. First one is a Hollywood bridge. Hollywood bridge is consisting of banding done on the primary molar teeth and from the band wire extend into the anterior rugae region that engages the acrylic portion that engage acrylic teeth. Next group of appliances, fiber reinforced composite resin. In fiber reinforced composite resin, a strip of fiber reinforced composite resin is cut and it is adapted to the lingual surface of the anterior teeth, primary anterior teeth. After adapting it, the position is adjusted such that occlusion, it should not interfere with the occlusion. And then after evaluating the occlusion, the material is light cured and a pre-extracted primary tooth or a composite resin can be adapted to the tooth surface, adapted in tooth shape, and it can be bonded to the fiber reinforced unit. Next appliance is a grouper appliance. As the name suggests, it was introduced by Jasmine and Grouper in 1984. It is consisting of acrylic teeth that is attached to the metal cleft that is soldered into the palatal wire. This appliance should be placed immediately after the extraction of the primary teeth. That's all about the fixed type. Next group of appliances, removable space maintainer. As the name suggests, it can be easily removed and inserted by the patient. In this, a cast is made The cast is evaluated whether we should go for a space maintainer or regainer. For space maintainer, non-restorable teeth are extracted or scrapped off from the dental cast, and in the scrapped area, cold-cure acrylic is placed, and acrylic teeth are adapted in the natural position to make it functional. This removable space maintainer can be of four categories. It can be unilateral non-functional, that is, tooth is not placed, or it can be bilateral non-functional space maintainer. The functional type can be either unilateral functional space maintainer or it can be bilateral functional space maintainer. So the indication includes when aesthetics is of more importance, abutment teeth cannot support a fixed appliance, it can be used. When permanent teeth are not fully erupted into the oral cavity for adoption of the bands, and when there is multiple loss of deciduous teeth. Contraindication, when there is lack of patient cooperation. In case of young children, we can go for removal appliance. And if the patient is allergic to acrylic material, in case of epileptic patient and children with possible caries activity. Brewer has classified these removable dentures into 8 types. Class 1 includes unilateral maxillary posterior. Class 2, unilateral mandibular posterior. Class 3, bilateral maxillary posterior. Class 4, bilateral mandibular posterior. Class 5, bilateral maxillary anterior posterior. Class 6, bilateral mandibular anterior posterior. Class 7, one or more primary or permanent anterior. Class 8, complete primary. Now we will know what are the advantages and disadvantages. The advantages include it is easy to clean and permit maintenance of oral hygiene. Next, it will stimulate the underlying tissue and the eruption of the tooth is also stimulated. Next, the band construction and elaborate skill is not needed and instrumentation is not required in case of removable appliance. And finally, alteration can be made without changing the appliance is also the advantage. Disadvantages includes it cannot be used in uncooperative patient and it may also cause irritation and allergy to underlying tissue. That's all about space maintainer. Now we will discuss about space regainer. As we discussed, these are used to regain the space that is lost by the drifting of the teeth and maybe either extraoral or an intraoral fixed or removable appliance. By definition, it is a removable or fixed appliance capable of moving a teeth that is displaced into its proper position in the dental arch. Coming to the types of space regainer. As with the space maintainer, it can be a removable or fixed type. Removable includes various modifications of the Foley's appliance. Fixed space regainers includes open coil space regainer, that is Hertz space regainer. It can be a jack screw space regainer, Gerber space regainer, Holtz lingular space regainer, or it can be a transpalatal arch. The removable appliances. The removable appliances essentially consisting of a Foley's appliance that can be modified with a jack screw. By activating the jack screw, minor tooth movement can be made, or it can be a Foley's appliance with split acrylic dumbbell on near to the posterior teeth. By opening the dumbbell, we can bring about the minor tooth movement, or a Foley's appliance with finger spring. Activating the finger spring can also bring about the minor tooth movement that resulting in regaining of the lost space. Next is open coil space regainer, Hertz space regainer. This consisting of an open coil that is adapted to the loop. In the loop U extension, junction between the anterior and the U loop extension, a solder is placed that will act as an anterior stop. The spring is compressed and it is 2 to 3 times extension is compressed and it is adapted into the anterior portion. Opening up of this loop brings about distalization of the tooth. Next is Holtz lingual arch. It is another method of distalization of the molar by incorporating a U-loop into the lingual arch. Such modification is known as Holtz lingual arch. Minor amount of distalization can be achieved by opening up of the loop. So, to conclude, we have discussed what is the importance of maintaining the primary dentition, factors to be considered in assessment of space loss, what are the treatment planning in space management, definitions of space maintenance, space maintainer, and space regainer. What are the objectives of space maintenance? Indications and contraindications of space maintainer. What are the requirements of space maintainer? Its classification and various types of space maintainer. So, properly maintaining the space that is lost by the premature loss of the primary teeth not only prevent the drifting of the teeth but also help in the stability of the dental arch, and it also guide the permanent teeth into its normal occlusal position. Thank you.